Now, Health Minister Dr. Joe Phaahla is today visiting Kalafong Hospital in Attridgeville in the city of Tshwane. This follows days of disruptions by members of Dudula Operation Movement. Yesterday, the group opened a case against the hospital CEO, Dr. Matjila. They claim he's harboring immigrants at the hospital. Nahau says the workers and patients are being inconvenienced. Right, let's in fact go to Pule Letshwiti-Jones, who's in Kalafong Hospital, where the minister will be briefing the media. I see you're already inside the hospital there, Pule, so I assume that you'll be getting an update from the minister about this very important topic. It's been boiling for a couple of weeks now.
Indeed, it has been boiling for a few hours, and earlier on we did speak to Tali about how we were waiting for the media briefing to start just after the Health Minister, Dr. Joe Phaahla, had conducted his oversight visit within the hospital. That was supposed to start at 10 a.m. It's still just about, if I stand to be corrected, 11 minutes past 12, and there's still no media briefing. We've just been told now that we should wait for 10 minutes and the media briefing will get underway, but still we're just waiting in suspense to find out what is the way forward. And of course, while this is the case, we're still communicating with some members of Operation Dudula who have now just told us that they've been called in alongside the members of the EFF by the Health Minister, Dr. Joe Phaahla, to sit down and have a meeting. Obviously, I think this will be to try and find means as to how they can start taking this matter forward, how they can mediate and find each other and have a meaningful solution to what has been happening here at the Kalafong Hospital in Attridgeville. This, of course, comes in the wake of what we've witnessed yesterday and today, where we saw a physical scuffle between the Red Berets and members of Operation Dudula. This after their views both clashing. We understand that the EFF is saying foreign nationals should also be treated with dignity and have that particular access to health care, while Operation Dudula is saying the opposite. They're saying South Africans should be prioritized and that undocumented and documented foreign nationals should have their medical permits or money when having to have access to medical facilities at any hospital in the country.
And Pule, in terms of what's been happening in the last 2 days, patients not being allowed to come in unless they produce, for instance, documents showing that they are legal, etc. What's happening in that front today? Are police there to ensure that this doesn't happen?
Yeah, well, police are here to ensure that that court interdict, which was issued out by the courts last week Friday, is enforced. It speaks to how there cannot be anyone, whether a political party, whether a group or community members, coming in and blocking the entrance at any hospital, particularly this one here, Kalafong in Attridgeville. We did see them today beefing up their numbers, actually saying that they will be calling for backup if the standoff between the two groups does intensify, which we did see it having to spiral out of control, where members of Operation Dudula were allegedly hauled away and police officials having to now come in and intervene to ensure that this problem does not spiral out of control. But I think what's more important here is that meeting which will be taking place between the Health Minister, the Red Berets, and of course Operation Dudula. Quite seemingly so, it will also be quite interesting to see how it unfolds in terms of having to have the two groups mediate, because as it stands right now, there are stubborn groups who are loyal to their views. So having to find a mediating process between the two will be something challenging for the Health Minister. And for us, we stand here in suspense, waiting for this media briefing to start, as I just have said, in the next 10 minutes. And we hopefully trying to get that information to see whether the Health Minister will be having solutions that will speak to other challenges in his hospitals, whereby medical health workers have raised issues such as having to work under strenuous hours, and that the influx of patients is just something which is overwhelming. So we will be waiting to see what the minister has prepared for us after having come from that oversight in this hospital.
All right, Pule Letshwiti-Jones at Kalafong Hospital in the city of Tshwane. Let's leave it there for now. It's quite an important topic, especially because healthcare workers have said numerous times that the ratio between themselves and patients is just unbearable.